Well, you may be aware, as I announced in the course of the budget speech, that we instituted the Tertiary Referrals Board, where a consultant refers a patient to a tertiary centre, either in the UK or in Spain, and there's a quality assurance level, which is constituted by the Tertiary Referrals Board, made up of senior consultants within the hospital, who decide whether the referral is in fact adequate because it is necessary, or whether that particular care or a particular review could in fact be done in the GHA.
Were the changes introduced because the system could have been open to abuse, not from the GHA, but from the private hospitals themselves, where they perhaps could keep somebody for a week where they only needed 2 days?
Well, I think all government systems, especially the larger ones, and the GHA, of course, is probably one of the biggest government services, is open to abuse. But the primary reason for the Tertiary Referrals Board is first and foremost clinical and patient care. One of the things that I was told initially was that if a patient need not travel, especially when they are living with a particular terrible condition such as cancer, they should, wherever possible, have the care in Gibraltar. But of course, if the care is required in Spain or elsewhere, then they should be referred. But like you also say, it was inevitable that in some respects, patients perhaps may have overstayed in a particular institution, not because the patients requested it, but because the communication between the GHA and the private institution was not as seamless as it should be, and therefore the TRB has a quality control, but also now has structured systems to ensure that there is audit, and there is also prior control of the number of days that a patient has to stay in a tertiary referral centre, so that we now have a continuous daily review of a tertiary referral patients, whether in the UK and in Spain, and we ensure that patients spend no more than is absolutely necessary for the care that they require.
In your budget speech, you said you wanted to improve patient care for less. What guarantees can you give that cost cutting won't result in worse care?
I think I can give an ironclad guarantee. Remember, Christine, that the decisions and the policies that I make are made after very fulsome consultation with the people that actually know what they're talking about, and they are the consultants, the GPs, the nurses, the clinicians. And so they are advising me how we can provide even better clinical care at lower cost and therefore better value for money. You will recall that I announced some months back visits with my medical director to the UK, where we met with different NHS providers in the UK, where we focused on the fact that Gibraltar lacks, unfortunately, economies of scale. The NHS England is a vast organisation with millions of people, and they therefore have those economies of scale where they can purchase from pharmaceutical companies very big quantities and therefore have better prices. Gibraltar, because we produce our own electricity, our own water, because we provide all of our health services, we do not have those advantages, and therefore we are seeking and very actively exploring whether we can actually plug in to various areas of the NHS in terms of procurement.
You gave a commitment as well at the last budget that you would be within budget within your first year as Minister for Health. Are you on track?
Remember that we also made the point that, for example, in Germany, if you take their GDP into account, 8.5% is spent on healthcare, and that includes long-term nursing care. In Gibraltar, if you include the GHA, the elderly residential services, to include domiciliary care, we spend around 7.5% of GDP on healthcare and residential care. If you also take into account the fact that over the last 5 years, our GDP has grown by 45% to 1.9 billion, and the fact that we always spend over 6% on healthcare, and I've just given you the figure, 7.5%, it means that we are in fact always investing more in the healthcare with the growth of GDP.
But Minister, are you within budget?
That I will be able to tell the public once we do the budget session.